Hi guys. This is gonna be a different type of video for me. Um, Basically, what this video is for is basically to talk about the sicknesses that I have, uh, and to see if other people out there on YouTube can see this video and relate to what I've been going through for the last 15 years of my life, with the different diagnoses that I've had, um, the illnesses, the hospitalizations, a lot of stuff that a lot of people don't know about me. They don't talk about it very much, especially online, because you know, anybody can see this stuff. But I've, over the years, over the last 15 years, since 1999 up to the present time, I've kept health records on myself, um, for all the. Basically, I have a lot of gastro problems. My gastrointestinal, my esophagus, my stomach, into my intestines. That whole that's for the past 15 years, I've had terrible gastro reflux, esophagitis, peptic ulcer disease. Uh, I've had candidas, Helicobacteria pylori. I've had herpes simplex virus in my esophagus. I've had so many different, GERD, gastroesophageal reflux disease, esophagitis, chronic dysphagia, inflammation. I've had all that in my gastrointestinal area. We'll keep it at that. So basically, this here, as you can see, is a stack of different diagnoses that I've had over the years. On I believe it was May 20th, 1999, that this first happened to me. Was admitted into the hospital in my town, and I had such a bad, inf- I had a, I guess you can say infection, whatever. I'll read it. Some of it says it was so bad inside me that I could not swallow my own spit. I couldn't eat. I couldn't drink. I was hospitalized for 12 days. Out of those 12 days, I couldn't eat or drink for 10 days. And that's not a lie. I was being pumped with medications to kill the infection by IV. And one of the IV was, the infection was so strong it would burn my arm, my entire arm. I couldn't move it. And that was on a daily basis. So it was 12 days in there, 10 days with it. So basically, uh, like for the time they call endoscopy or gastroscopy. They put the light down into your esophagus, into your stomach area to see what they can see. So the very first time they did that, they said that severe esophagitis. They want to rule out had this Helicobacteria pylori, which is a really bad infection you can get in your gastro area, and it's not pleasant. Um, and it was the infection for the candidas or Crohn's disease. Basically, my doctor said at the time that I had a herpes simplex virus, basically, which it sounds terrible. It's herpes, like I'm thinking herpes. That's not like a. He basically said the infection you can get with a cold sore on your face. He said I had it in my esophagus. So when they put the light down the first time, the operation says gastroscopy with a biopsy from the antral area to rule out Helicobacteria pylori type of infection, biopsies from the esophageal junction area as well as from the mid-esophagus. So basically, their focus was my esophagus because I couldn't swallow my own spit. I could barely take enough water to swallow pain medication that they were giving me at the time. So this was May 21st, 1999. I was 16. That year, that December, I would have been 17. So I was 16 years old when I had got this very, very bad infection. So the procedure, this patient had a gastro examination carried out the same, which the esophagus, stomach, first and second parts of the duodenum were examined. There was evidence of inflammation that was seen mostly in the esophagus. There was a question whether this patient might not either have Crohn's disease or Manila candidas or just a Helicobacter pylori type of infection or just gastroesophageal reflux disease, which is GERD. Uh, they thought that was responsible for my ulcerative esophagitis. So ulcerative ulcers back then, as well. There were random biopsies were done from the epigastric junction area as well as from the mid-esophageal area. A biopsy was also done from the mid-esophagus for cultures to rule out candidas, and a biopsy was done from the antral area to rule out Helicobacter pylori type of infection. and my duodenum area appeared quite normal, which is almost where your stomach enters your attaches to your small intestine. Um, basically, whenever they submitted the specimens for my thing, I had acute and chronic esophagitis, extensive gastro junction. I had granulated tissue with acute and chronic non-specific inflammation and ulceration in my mid-esophagus. Mild nuclear atypia is present, however, no evidence of malignancy, which is really good to hear, or significant dysplastic changes suggestive of herpes infections are present. So that's where the herpes came from in my esophagus. I didn't have the H. pylori bacteria then, but at different parts over the last 15 years I have had it. And then in June of 1999 they followed up. They said that my the treatment in the hospital it said in today's examination we see that there's a tremendous improvement over the appearances in the past, and although no definite ulcers were seen, there was some esophagitis seen, and a biopsy has been done from the esophagus. So basically we could say that my first diagnosis was esophagitis, gastroesophageal reflux disease, some mild chronic inflammation, no Helicobacteria pylori there identified there. Here again, microscopic diagnosis, esophageal. I see these are big words. Esophageal squamous epithelium showing some fibrosis and aggregates of the lymphatic infiltrated mixed with non-specific inflammatory cells and underlying stroma, consistent with chronic esophagitis. No evidence of dysplasia or significant atypia, which basically, I guess it's esophagitis, but it's not going, it's not increasing at a strong rate at that point. In December of 1999, the same surgeon. So my post-operative diagnosis was a mild reflux with inflammation in the esophageal area junction area. So they did the operation was a gastroscopy with a biopsy from the pyloric end of the stomach to rule out Helicobacter pylori type of infection, and they did a biopsy from my esophagus there as well. And then they put this patient who has had a severe esophagitis diagnosis, perhaps due to a herpes infection, on May 21st, 1999, and then had a repeat scope done after he was adequately treated for this disease, which was 12 days in the hospital again, which was, I could never go through that again. I thought I was going to die. It basically, IV treatment saved my life. The medication they were giving me, because I couldn't swallow anything. Everything burned. It was like the burning pain was so bad. It was nothing like I've ever felt in my life. I mean, it's as if somebody was shooting me in the leg with a gun. Like, it was the worst pain I've ever felt in my life. And over the times, over the past 15 years, I felt like this might be coming back, but it hasn't been that strong, to the point where I can't swallow my own spit. Like, the pain would have been so bad I would keel over crying. It was that bad. You know, I was only 16 years old, so I didn't really understand what was going on with me then. I just thought I was going to die. It was really that bad. So here they said he had a reoccurrence of dysphagia, for which he underwent a gastroscopic examination today, in which the esophagus, stomach, first and second parts of the duodenum were examined, which is, like I said, down by the... while there was no evidence of the frank peptic ulcer in the duodenum, there was evidence of some inflammation of the pyloric end of the stomach, from where a biopsy was done to rule out Helicobacter pylori type of infection by doing a repeat test. We also found some mild inflammation in the esophagus area. This area was also biopsied. Otherwise, the rest of the esophagus appeared quite apparently normal. So that was in June. That was in December of 1999. So they had submitted specimens in December of 99, and biopsy labeled esophagus junction, and the specimen submitted mucosa consistent with mild chronic gastritis with some effacement of the surface epithelium, which means that some of my esophagus was scarred. It was scarred to begin with. I don't know why. Maybe from an earlier age, because I had a hard life. I'll put it that way. Stress was always a big factor in my life, so they think that stress caused a lot of what happened to me at a young age. Let's see here. So then after that, they said from 1999 to 2001, I had a few scopes done. I can't quite think of the exact dates. I have one here. It's from May 4th, 2001, with the same surgeon who worked on me. Was one of the best surgeons in the world when it came to this stuff, and he retired slightly after he treated me. The microscopic diagnosis: distal esophageal mucosal biopsy, moderate chronic gastritis with glandular mild atypia, mid-esophageal moderate chronic esophagitis with mild atypia. And right here, he did another scope, like I said, May 4th, 2001. The post-operative diagnosis for me was an esophagitis with an open esophageal junction area. The operation was a gastroscopy with biopsy from the distal esophagus and mid-esophagus. Basically from here and here they took biopsies. The procedure, they said that this patient has had severe acute chronic esophagitis in 1999, and there was a suggestion that it might be due to herpes zoster. Today he's had a gastroscopic examination carried out 2 months after the Losec has been stopped, which was the stomach medication they had given me. The esophagus, stomach, first and second parts of the duodenum were examined, and the duodenum and stomach appeared normal. The esophagus also appears nearly normal. We noticed the patient still has this lower sphincter of the esophagus, that is, esophageal junction remains open all the time. There's very little inflammation seen in the esophagus in 2 areas where we thought we saw some change in the color of the mucosa were biopsied. One was in the distal esophagus, the other was in the mid-esophagus. So that there, what he was saying there was that he explained to me that the way your stomach goes, like that, he said that once your food enters your stomach, there's a little flap, a sphincter muscle, I guess you call it, that after you eat, it closes to prevent acid from refluxing. My muscle there stays open all the time, so acid comes up all the time into my stomach, into my esophagus. I can be sitting sometimes, I can get up and I'll spit out acid. It's really bad. Here I had one in 2005. Big step from 2001 to 2005. But I suffered with this for the longest time. Let's see here. January 24th, 2006. It says, you guys can see it. Date of birth right there. December 14th, 1982. So that's a few people who don't believe how old I am. Okay, this doctor here he was one of the best as well. So this letter here, he sent to another doctor who referred me to him. He had problems with oral dysphagia dating back to age 13. I had a dilation through to number 15 in April of 2004, which means they stretched my esophagus, which number 15 is a joke. I've had it stretched still. He was felt at that time to have a type 1 hiatal hernia, but there's no evidence of any stenosis seen, and the dilatation was empiric. The barium swelling was done other than a tiny hiatal hernia. He had major dysphagia. Basically, I can't eat a whole lot of things. I choke easy. Every time I eat something, I have to drink because I choke. They call that dysphagia. Yeah, something like that. He says, when I saw him for gastroscopy July 20th, he had mild grade 1 gastroesophageal reflux disease with the lower esophageal ring. No benefits. He has not only the dysphagia but also intermittent epigastric burning, sometimes radiating through to his back. See here. His diagnosis on me was basically, okay, let's see here. He said, I would suggest the barium swallow and asking the radiologist to study the area for Zenkers, which would be unlikely in a 23-year-old young man. I did the barium swallow, I remember that. The endoscopy today, minor irregularity of the Z line, grade 1, with no features of a ring on careful inspection today. Gastric side was normal, and again his stomach, pylorus, and duodenum were normal. I did 3 biopsies from the antrum for any evidence of H. pylori, and if positive, I would certainly suggest a full course of therapy. And he said, I am suspicious of a functional origin in this 23-year-old young man, but we should rule out a local source with the proposed barium enema. So basically, they put me on a lot of medication, so much stomach medication, every type of stomach medication you can think of, I've been on. I currently take 5 different stomach medications for, esophagitis, peptic ulcer disease, acid reflux, GERD, you call it. Here's from the scope from 2007, which was done by another surgeon. He says the esophagus is cannulated, which I'm not sure what that means. Probably should have looked into it. The esophagus, gastric cavity, and duodenum are all examined. The stomach and duodenum were all normal. The examination of the duodenum was done up to the second and third portions. The gastric cavity was also examined by reflection of the scope in order to better visualize the inside of the hiatal hernia. When we suction a little bit, we see the appearance of a Scatzy ring, which is confirmed when the scope is pulled out. I just had to aspirate a little bit of air, and we see the ring aspect of the distal esophagus. This is a witness of GERD, gastroesophageal reflux disease. I had no esophagitis at that point. At that point, I was still having a lot of pain. They just told me to keep taking this particular, at that time, a certain type of medication that I was taking, and I stayed on that medication for a long time. And throughout this whole process, I've been taking a lot of pain medication because my situations were just terribly. So, right now, at this particular point, within the last 2 years, I moved back to my hometown. And I seen a doctor who's from another country. So it was July 17, 2012. And again, December 14th, 1982, July 17, 2012. I just keep putting out my birth date there because people seem to think I'm 19 or 20. Here I am on July 17, 2012, I'm 29. I turned 30 that December. So here, basically, this is his consultation after he did my gastroscopy in July of 2012. This was his findings. He's a 29-year-old man who has had a long-standing history of systematic problems. His present symptoms are that of epigastric pain, at times severe. He has nausea, vomiting, heartburn, and reflux. He has had occasional resternal dysphagia for solids as required dilatation in the past. My esophagus being stretched so I can eat better. I had a bout of hematemesis. I forget exactly what that is. I had weight loss or change in my appetite. His past medical history includes acid, pepsin disease, and a Scatzy ring. He suffers from depression. He has had a right hiatal hernia. They talk about my family history. They say I'm a non-smoker. I don't drink alcohol or coffee. I'm allergic to penicillin, my medications that I'm currently on. He said on physical examination, his head and neck, chest, and cardiovascular examination are normal. His abdomen is soft, non-tender, non-distant, with no irregular mass. He has no liver. Okay, let's just get to it, I guess. So the gastroscopy was introduced, and they're under the gastroscopy was introduced under direct visualization with no difficulty. He says the proximal, medial, and distal esophagus appeared normal. There is a minimal sliding hiatal hernia and slight irregular Z line. In the stomach, the fundus and corpus appeared normal. In the interim, there were inflammatory changes along with multiple ulcerations. This is where I found out where I had peptic ulcer disease. He said there was a 3 centimeter small oval linear ulceration and a 1 centimeter oval ulcer at the pylorus. The pylorus was passed and there was a bulbitis along with circumferential linear and partially healed superficial ulceration. That's an ulcer that was partially healed. There is some friability here as well. Remainder of duodenum appeared normal. That usually was. Biopsies for the histology were obtained from the distal duodenum, bulbous, pylorus, antrum, fundus, and distal esophagus. And then they removed the gastroscopy and they dilated my esophagus again with a 56 size bogey, Maloney bogey or something like that. The previous one, I forget, was 20. So this was 56. So basically, his findings here in July 2012 were minimal sliding hiatal hernia along with slight irregular Z line, multiple antral ulcers, 3 centimeter linear ulcer, small oval and pyloric channel of 1 centimeter, bulbar ulceration, circumferential linear partially healed, esophageal bogey dilation associated with much resistance. In summary, this 29-year-old man has findings of peptic ulcer disease. He has multiple ulcerations, however, and somewhat atypical appearance. His dysphagia may be due to a narrowing in his esophagus, for which today's dilatation may be helped. He talks about how he placed me on different medications. He's going to review my histology and check me for Helicobacter pylori. He asked for gastrum levels, calcium. So that was my findings in July 2012 with him. That confirmed to me that okay, something's obviously not going on right here. So he's been in consultation with my doctor. So these are just the different follow-ups here. September 2012. He's a 29-year-old man who has been found to have ulcerative esophagitis. Complained of nausea and vomiting. All the medications I'm on. This is where, this type of plan was, I would suggest that he therefore be admitted on a pantoprazole drip as well as Gaviscon suspension, 30 milliliters 4 times a day, and sulcrate 1 gram, which is a medication, twice daily to see if we can shut off the acid as it may help. And once the symptoms subside, possibly continuing with the same treatment, or it will keep him in remission. He's quite anxious as well, and obviously this has a significant part to play on his systemology. So basically that part, what he means there is for 2 weeks, I had to go to my local, it wasn't a hospital anymore, it was a clinic, and I was receiving a medication called Tecta. I was receiving, I had to go twice a day, or 3 times, I forget. I don't know how I could forget. But I had to go and get 15-minute injections, direct IV, of that stomach medication to clear all that's all going on inside me there. That essentially did not work. So in October, I believe October 25th to November 2nd, I was admitted to a hospital. Before that I was admitted in 2004. The first one was 99, 2004. 2006 I was, actually 2003 overnight hospital, 2006 overnight hospital, 2000, trying to think here, 2009, yes, then too. So here, this is from October 25th to November 2nd, 2012, when I was in the hospital. I was given 24 hours of that medication infusion. He gave me another medication. It didn't make any difference. His investigation showed a normal Let me see here. He's all these. Again, he did a gastroscopy, showed a moderate degree of bile reflux along with mild bulbitis and scar tissue and bulbous and second portion of the duodenum, which the duodenum or whatever before was always good. Now it was here. I have suffered from depression my whole life, so I was seen by psychiatry. I was placed on a strong pain medication. It says he does have a history of peptic ulcer disease, and he has scar tissue in the duodenum, which I didn't know until then. And this is 2012. From 1999 to 2012, 2004, all these findings, my duodenum area was normal. So here I'm scar tissue. There are findings of it to correlate with his persistent symptoms and ongoing pain. He has had a normal ultrasound here, his pancreas. So he had a CAT scan of my abdomen and pelvis. He thinks I had gastric dysmotility. Not really, I haven't really looked much into that. So basically, he ordered more tests after I was admitted. I left the hospital. I couldn't stay there anymore. It just wasn't working for me. I had to leave. So then I was next in April 2013. Sorry, 26 minutes. This is in April 2013. This was the gastroscopy, and this was the results. The upper esophageal mucosa appeared normal. There was a patchy arrhythmia at the gastroesophageal junction with an early Scatzy ring and a small sliding hiatal hernia. The proximal gastric mucosa appeared normal. There are findings of antral arrhythmia. There are findings of bulbar deformity from a previous peptic ulcer with a scar. The distal duodenum appeared normal. Biopsies were taken from the proximal and distal duodenal mucosa, proximal and distal gastric mucosa, and lower esophagus. And a size 56 dilator was introduced and passed to stretch my esophagus. In summary, there are findings of patchy esophagitis, which was in 1999, Scatzy ring, antral gastritis, bulbar deformity with a scar from a previous peptic ulcer disease. He did histology tests, and he was gonna get me to continue with the medication I was taking. So that was 2013. Here, okay. And I've been followed by this doctor since 2012. And then here's my latest one. September 26, 2014. Today I had an upper endoscopy done. The upper esophageal mucosa appeared normal. There was a Scatzy ring in the lower esophagus with a stricture. There's patchy arrhythmia at the gastroesophageal junction. There's a sliding hiatal hernia of 2 centimeters. Proximal gastric mucosa appeared normal. There are findings of moderate antral arrhythmia as well as inflammatory bulbitis with bulbar deformity from previous peptic ulcer disease. The distal duodenum appeared normal. Okay, that healed, unhealed, healed, unhealed, it seems. Biopsies were taken from the proximal and distal duodenal mucosa, proximal and distal gastric mucosa, and lower esophagus. This time they dilated me with a size 58. The findings are grade A esophagitis with a sliding hiatal hernia, Scatzy ring, antral gastritis, inflammatory bulbitis with bulbar deformity from previous peptic ulcer disease. And then since I gave him copies of my health records that I've been keeping on myself, he says he does have a history of herpes esophagitis dating back to May 1999. I have asked that the specimen be stained for herpes as well. He has a history of eosinophilic esophagitis. Eosinophilic, I don't have a clue what that means. But esophagitis has always been there. It seems like that's never going to go away. So basically, from the specimens of that September 2014 examination, says clinical history: 31-year-old man with dysphagia, which means hard time swallowing. and 1 is duodenum, 2 gastric, 3 esophagus. They talked about the 3 different specimens that they received, one from my duodenum, 1 from the gastric, 1 from the esophagus. Let's see here. The final diagnosis for me in September 2014, duodenum biopsy, mild chronic inflammation, non-specific. My stomach biopsy, mild chronic gastritis, no Helicobacter pylori identified, which is good, because I've had it before. Esophagus biopsy, squamous epithelium with mild chronic inflammation and features consistent with reflux change. And then they put a comment, the esophageal biopsy shows squamous epithelium with small amount of lymphocytes and eosinophils and rare neutrophils. These words. Viral cytopathic changes are not observed. They stained me for fungus, for like a fungi, and it says they were going to do a herpes stain, and then they would follow up later on with if I'm negative or positive for the herpes virus. They said here, immunohistochemical stains for herpes virus 1 and 2 were performed on specimen 3 and are negative. There's no change in diagnosis. So basically, in the esophagus, they checked again. Here, 15 years later, they checked again to see if I had the herpes virus, which almost killed me in 1999. 31 minutes just going over health records. So now, I guess the next step after what's going on with me right now, the medication I'm taking, if it's not working, I got to drink this. I can't eat certain stuff, I can't drink certain stuff, I have to take a lot of stomach medication to downsize the acid, because I have reflux. I sleep on a recliner. I recently bought a recliner, and I sleep on that at night because I can't lay flat. The gas, the acid comes in my throat and burns. It just burns me. Over the years, I'm at a good weight now. I've managed to put on weight, but for the most part of my life, I weighed about 130, 135 pounds. Now I'm about 195, which is unbelievable. For the past 15 years, I have been sick. I've been sick with all these different ailments, and at this point, I told this new doctor, this surgeon, I'm fed up. I can't do any more of this. I mean, I had a bad attack last night, and the pain was so severe. I mean, I'm on a strong pain medication. I'm not going to say it, but I'm on a very, very strong pain medication, and sometimes that doesn't do anything. And if that medication were given to people through IV, it could put them in a coma. I guess the dose that I'm taking, if you go down certain milligrams, they give it to IV through patients in palliative care, people who are dying, basically, to give it to them to just anyhow. So despite having that, I still have this incredible pain all the time. Like where he pinpointed on my stomach, where I had the ulcers and all that. And there was one here, and then one way over here, and they reopened. They kind of come back. They healed, but then they started to unheal again. Just basically from whether I eat a meal or not, or whether I eat a big meal. It really doesn't matter, because I have pain all the time. This ailment is killing me. I feel, on all honesty, it's killing me. I think that eventually it's going to lead to esophageal cancer, which is what another doctor had previously told me, and I'm scared to death to think about it, because I am not getting better, and it's been 15 years, and I've been up and down for the last 15 years. I told my doctor, I said, I can't take this anymore. So I seen him 2 weeks ago, and he told me to take this other medication, which I've been taking for over the last 10 years, whatever. take it for 2 weeks. We'll go from there. If things aren't happening, we'll have to do surgery. Well, I felt like saying to him right there, look, when I had this infection first in 1999, in 2000, I was put on a list for a surgery to correct the fact that muscle being open and letting the acid out. They were going to do an operation to keep that down. So when I do eat, it opens, and then after I'm done eating, it closes so the acid doesn't come up and burn all my esophagus and my throat. Like right now, I'm having a hard time to talk. It's because the acid is burning in my throat. Like right now, as I'm speaking, my stomach is on fire, probably because I'm talking about it. And the more I talk about it and think about it, the worse it gets. And when I'm under stressful situations, like I've been diagnosed with post-traumatic stress disorder, depression, borderline OCD sometimes. I don't really know about that, but I remember seeing a psychiatrist, and he diagnosed me with 6 different ailments one time. Some I agree with, some I don't agree with, I guess. I will say this, and this is not a pity party on my part. I have had a hard life. I grew up with a father who was an alcoholic. So, whatever. I don't care if he sees this or whatever. He did wrong, and to his family, and to this day, people are still affected by what he did. That's why I don't have anything to do with that person, because of that. Anyways, so all these stuff contributes to the pain and the inflammation and everything that I've had over the past 15 years. So from May 1999 to present time, November 2014, it's been 15 years. I told the surgeon I've had enough. I can't do this anymore. The pain is too intense. I said I'm taking pain medication. I'm taking 5 or 6 different stomach medications. Plus I take other medications. I have restless leg syndrome. And if I don't know if you know if you don't know what it is, research it. Your leg feels like you have ants crawling up and down it. You want to cut your leg off. It is insane. I would not wish restless leg syndrome upon anybody. My worst enemy, nobody. I remember I was awake for 3 nights straight wanting to cut my leg off. Until finally a doctor took me really seriously after 3 days of hospital visits. Put me on a medication, which is a Parkinson's medication, but it stopped the restless leg syndrome. I was able to relax with it. And this was 3 years ago or so, and I've been taking that medication ever since for that. So that was like a miracle, because I thought I was literally going to take an axe or a chainsaw and cut my legs off, my one leg off. It was always in my right leg. It was never in my left, it was just my right leg. But it was insane. It feels like bugs crawling through you and you couldn't do nothing about it. You would stretch your leg as much as you could. It was insane. I take anti-anxiety medications. I take mood stabilizer medications. They kind of work together. All these stomach medications that I take medication at night for sleeping, because I'm an insomniac. Insomniac runs in my family. If I don't take anything at night, I will not sleep. I'll be up. I mean, I did night shifts before forever, and to come home in the morning and sleep was impossible. I would do 3 night shifts, and then to run of those 3 night shifts, have 4 hours of sleep because I can't sleep, and I have to deal with that on a daily basis. Like the fact that at night I can take all my medication, which if given to a normal person would knock them out. Since I've built up a tolerance over the years, it doesn't affect me as it should, which is sad because sometimes I do go to bed at night very early and I don't fall asleep for hours. Like I said, now I'm a 31-year-old man who's going to be 32 next month, December 14th, and I sleep on a recliner at night because I have to, because I cannot lay flat. And before I had my recliner, my wall was like this, and then I had 2 pillows, and then I had one on an angle and then one straight up. So I slept every night, basically like this is my body. This is my legs. I was like that. If you want to switch it around. So I was laying straight up against the wall, and I said, I can't do this anymore. I got to get something that's gonna help me try sleep better at night, because I'm a stay-at-home dad to a 3-year-old boy, so I have to be alert, active, and uh, well, and every day is a struggle. With this peptic ulcer disease, esophagitis, dysphagia, all this stuff that I've had, these herpes, zoster, simplex virus, everything, it all comes back to me, and then it's just like I'm putting my story out here right now to see. I'll probably get nobody listening to this. It's 40 minutes. Like I said, it's 40 minutes, but it's 15 years for me. So 40 minutes. It's not. Plus, I also take. I have very strange pains in my body sometimes. I take muscle relaxers for that, which could be due to my restless leg syndrome, or the fact that I tense a lot. In my sleep, I tense a lot. I wake up sore all the time, so I have to take that. And that particular medication makes people tired, very tired. But I'm so used to it, it doesn't do anything for me anymore. Like, this is a bag of medication that I take. I'll admit there's some bottles that I have 2 or whatever because I haven't taken it. I try to not take as much medication as I can, because some of the medication irritates what I have, and there's nothing I can really do about it. Like, I mean, I find myself sometimes, I'll admit it, crying with the pain. Yesterday I had such intense pain from these ailments. It's so bad to the point where it's just like I have to take pain medication because it's so sore. I can just feel my ulcers just really burning. I can feel the acid coming up in me. I could stand up and spit out acid. Like, it's getting to the point now, like, hold on a second. I have to take a medication. Excuse me. So basically, I'm not quite sure why I really made this video. I guess it's kind of to let people know that, I mean, yes, I make videos and I play music, and, I try to stay upbeat, positive, but it's kind of hard when you have something beating you down every day. I mean, I'm not the only one in the world who has ailments, and I'm not looking for pity or anything, and I'm not saying, like, oh wow, he's really sick. It's just a part of me. I've never revealed to anybody on YouTube, my subscribers or anybody, and if anybody's taken the time to listen to this long 42-minute video, I appreciate it. That means, I guess, you show some kind of interest in me. I just want to know people out there who also have had, similar ailments that I've had. Like, I've had, esophagitis, herpes zoster virus, herpes simplex virus, esophagitis, peptic ulcer disease, dysphagia, like, all these different, bulbar deformities, all these antrum, scarring tissue. Like, I just want to know if other people have had similar experiences to what I have. And, like, it's hard. Like, I mean, I put all this paperwork, I summed it up. But here I have some pictures. I'm going to show you right here. This picture here is me on my 22nd birthday. Now, if you look at that picture and you look at me now, I'll never forget this day. It was December 14th, 2004. Dimebag Darrell, who was the guitar player for the band Damage Plan Pantera, was murdered on December 8th, 2004. And on December 14th, 2004, he was buried. So this was in my wife, who was my girlfriend at the time, was the university dorm room, and she bought me a cheesecake, because I love cheesecake. But it just goes to show you how small I was. I mean, I'm 22 years old there. I look like I'm 15. That was a very Nice time. So that was December 14th, 2004. And here is June 29th, 2005. When I graduated high school, I had my shirt off, and I'm holding up my diploma. Now, if you look at me now, look at me then, people say I look young now. There, I am 22, 82. 22, I was 22 there, I'll be 23 later that year. This is how I looked on my wedding day. Well, it's not that I want to keep my wife out, but I suppose it's kind of... I mean, I'm pretty skinny there, it's hard to see. This is, sorry, terrible example. There I am, right there. August 8, 2008, 888. And you can see how skinny I am. So just pictures that I just thought of off the top of my head. I found. I was so skinny for the longest time from this disease that I had, that at some points it was just like, people thought I was 13, 14, just like you guys are all thinking that I'm 17, 18, 19-year-old kid. I mean, if I look young now, those pictures there make me look like I'm 15 years old. I mean, I'm going to be 32 next month. And you think I look young now? But I mean, look at these two pictures of me. One's from 2004. One's from 2005. I mean, that's young. 21, 22, 23, whatever I was. I was put on a medication that increased your appetite. It actually made me gain weight, which was incredible because I always thought my whole life I was going to be around 130, 135 pounds. I always thought I was going to be a small guy. But for years and years I worked out at the gym. I was totally in shape. Incredible. I mean, I was bench pressing as much as a guy who was 230 pounds, and I was 130. Like, I was very much in shape, very much in shape. Like, I lived and breathed for the gym. But as I got sicker and sicker, I couldn't do it anymore. Plus I had different, like I had a 5-pound weight fall on my foot one time. I cracked me in the head. Just different. One time I was doing something a little too strong, and I snapped part of my tricep. I had this gym stupidity, just young, 18, 17, 18, 19. Knowing what I was doing, but not realizing that I could. Anyhow, so I when I went to college in 2004, I moved away to 4 hours away from my hometown. So I stopped going to the gym basically then. I still worked out at home, jogged on the spot and all that, but I wasn't in the gym, so I wasn't keeping myself in much good shape. But like I said, 2004, 2005, 6, 7, 8. Only in 2009, 2010 that I started putting on weight, because this medication I was taking was increasing my appetite, which was good because I didn't want to be 130 pounds forever. Like, I wanted to look more like a man. I'm just fed up, tired. People not taking me seriously, calling me a kid, saying, it's time to go to bed, you gotta go to school tomorrow. Like, it was like, fuck off, man. Like, sorry. I swear a lot, so I didn't swear just once in this video. But like, so 2008, 2009, I started putting on weight and my appetite increased. So, and here I am today, now at about 195 pounds, which is crazy. I still try to do, I still try to keep myself in shape. I don't go to a gym because I can't. My life, I've been a stay-at-home father to my son who's 3, so My wife was home for the first year of his life, but I've been a stay-at-home dad for the last 2 years of his life. So, my priority is my family and my health, and then making YouTube videos and such, teaching people music. So I don't really have time for a lot of that stuff. I don't have time for, music is my outlet when I'm not with my family. But anyhow, I'm glad that I suppose that I'm in the shape that I'm in right now. Although a lot of the medications has had a lot of very bad side effects on me, which is what a lot of medications can really do when you think about it. But some of them are a bit negative, and I don't talk about that because it's just ridiculous. Like I said, I'm just wondering about other people out there who have had similar, start off with one thing and go to this and go to that and go to this. Like I have peptic ulcer disease, 4 ulcers that were discovered in me. Before I was diagnosed with that, I remember being upstairs one day in my kitchen, and I keeled over crying in pain, and I said, I have to be scoped, I have to be scoped. I went to the hospital, they knew my history, they found out my history. A few days later, they scoped me. That's when they found out that I had peptic ulcer disease, and my ulcers were very bad. So I was pain, and now my throat, all here is all inflamed, is burning all the time. I'm in pain about 85% of my day. Like, it takes everything I have sometimes to do. Plus, I have depression on top of that, so having this brings me down. Like, I can't deal with this, I can't deal with that. Sometimes making YouTube videos is kind of like a salvation. I'm giving myself to, I'm playing music, showing people how to play music, but when it comes down to it, I'm a sick person. The fact that I have like a hiatal hernia, I can't lift heavy stuff. I have to watch what I do with that. With stress, daily things, anything that can come your way affects me very easy. It's not hard for me to suddenly work up a storm of acid in my stomach, in my esophagus. Some mornings I'll wake up with a burnt throat because of acid throughout the night in my throat, in my esophagus. Like right now I have a hard time to talk. That's why I woke up this morning with my throat burnt, my esophagus burnt, because I slept in bed last night, not on my recliner, but I still slept against the wall like that. There's so many issues. That's why sometimes when people, they ask me to do requests and stuff on YouTube, and I try to get around to it and all that, but I deal with a lot of health problems on a daily basis. Like, I'm not a very healthy person. For a person my age, I'm only going to be 32 years old, and I have the health diagnosis of a 55, 65-year-old man. I mean, this is kind of strange, but I'm going to tell you, people who have prostate problems usually are in their late 40s, 50s. I was seeing a prostate doctor when I was 17 because I had prostate problems. 17 years old. Doctor could not believe that he was seeing somebody my age with prostate problems. So that's another ailment. Plus I had migraines. I had to go for CAT scans and CT scans and everything. I've had all these ailments affect me throughout the last 15 years, from when I almost died in 1999 and to days, pretty much every night, where I go to bed depressed because of how terrible my day was, how sore I feel, how this medication is not working, how this doctor's not doing this. Like I said, I was put on a surgery list in 2000, but that surgeon who scoped me and did everything on me in 99 to 2001, he retired shortly after this list. So I got passed through the system big time, and I've told doctors over the years that I've been on this particular type of list, and nobody's ever taken me seriously. But now this new doctor, he doesn't know nothing about that, but he's saying surgery would be the next option for you, Aaron, to solve your problem, and I'm ready for it. It's been 15 years. It's been 15 long years. Some people, they deal with stuff for 30 years, but with this, it's so intense because it's my entire gastroesophageal junction area, from my throat, my esophagus, all into my stomach, and then sometimes I'll get like, just normal stomach pains, cramps, whatever. They're so intense, so bad that the pain is unbearable. And like I said, when the acid affects my ulcers, it is just incredible. It's pain, pain, pain. And I hate the fact that I have to take pain medication for it. I hate the fact that I gotta take 5 or 6 different stomach medications. I hate that I have to drink all these different things. And then this depression, the anxiety, the mood disorders, and like just different ailments. I don't know, I guess I'm just making this video just to show people a different side of me, I guess, that nobody's ever really known, I guess. It's, all this, I got stuff here too, and just, I got a page down here, it's different stuff I didn't bother bringing out. But if there's anybody out there, particularly with peptic ulcer disease, that can relate to what I have, I'd like to know. I'd like to hear from them. Tell me what they're going through, and if they're having a lot of the symptomatic pains I'm having. Because, like I said, in 1999, I didn't have peptic ulcer disease, but I had ulcerations that were not, they were found and not found, found, not found. So basically, if you think about it, I've had ulcers for 15 years. I never had like Crohn's disease or anything like that, which is kind of related to that, but a little bit different. I've had all these diagnoses: esophagitis, GERD, gastroesophageal reflux diseases, all these different diagnoses. Okay, try this stomach medication, try this one, try this one, try this one, to the point where at one point, taking 4 or 5, and it's not working for me anymore. So I'm due to see the surgeon. My surgeon, seen him a week ago. I'm due to see him this Friday. Here we are Monday. I'm going to see him on Friday, and I'm going to tell him, look, I can't do this anymore. I can't. You have to do something for me. You have to. Because it's getting to the point where sometimes I don't want the world to see me, because I don't feel like they could understand like what the hell it is that I'm going through, I guess, on a daily basis. So yeah, if anybody can relate to anything I said here, and if anybody's watched this, I didn't expect it to be this long, and I don't blame people for not wanting to watch it. Who wants to watch a 1-hour video on somebody talking about their health problems? It's just somebody else complaining. I try not to complain, but it seems like at the end of the day, when my wife and I settle down after I send us to sleep, it just comes down to it that I'm in pain, sore, can't sleep, my anxiety's through the roof. So, the acid, my secretion is very bad. So I'm just gonna end this video now. I hope that you guys could, some just now acid came up. Unbelievable. So if somebody can relate to the stuff that I've mentioned here, I'd like to hear other people's stories, because maybe we can help each other. It's like one person with one ailment, somebody else there has the same thing. So somebody can help me, talk to me about what I have, and I can talk to them and pass the information along between each other. Because some days I feel like I'm gonna die. I feel like the pain is gonna kill me. I feel like everything combined, it's just gonna be the end of me. But I try to stay positive for my wife, for my son. I just don't let him see me crying. Don't let him see my wife crying. See me crying. I make my videos and stuff, and that's kind of like my salvation. When I'm not, being full-time dad, husband. My hobbies are limited to what I can do. This disease, these sicknesses have altered my entire life for the past 15 years. And the past 15 years are basically what it should be, the glorious years of your life. And from the age of 16 up till right now, I'm almost 32 years old. I couldn't go to parties and drink a lot or whatever, because it was bad. Alcohol, oh my god. I don't drink. I mean, I've drank off and on, I'll admit. But I'm proud to say that January coming, it'll be 3 years since I drank alcohol. I'm a non-smoker. I never smoked. I never smoked marijuana or anything like that. The only thing I've ever really done is just alcohol and drink, just to kind of kill the pain and bury the problems. But really, it does neither, and it's not good for you, right? Alcohol is good for nobody. It's like the expression, one is not enough and two is too many, right? So I would always take it to the extreme. I'm sober from alcohol, and January 2015 will be 3 years since I had a drink of alcohol, and I feel good about it, because the last couple of years when I did drink, it was pain, bad pain, the worst thing you could think of for ulcers and everything I had. So, I probably should just end this right now. I'm sorry for taking it being so long, kind of making like I don't want a pity party or anything like that. But just want to share my story with people. I try to stay upbeat. I try to teach people music because it's my passion. I love it, and it doesn't require a whole lot of stuff for me to do. It's not an endurance thing. It's not so much a stress thing. It's not a situation where I'll sit there and shake, because I'm so nerved up and revved up and I can't sleep and I'm awake and insomnia and whatnot. So that's my life story for the past 15 years of my life. So for half of my life I've been dealing with this, and it's nearly killed me on numerous occasions. I thought I was going to die a few times. I didn't think I was going to go through with these sicknesses, especially for not eating or drinking anything for 10 days. Some people can't do that for one. I was 16 years old, and I didn't eat or drink nothing for 10 days. The only thing I had keeping me alive was IV and medications to kill that disease that I had, where I couldn't even swallow my own spit. I don't know what caused that. They never knew what caused it. In fact, I should add this, my doctor and that surgeon, who was known all over the world, had never seen what I had in my esophagus into my stomach before. They labeled it esophagitis, herpes virus, and all that. That's just a term they give it. They gave it whenever they had to do their summaries and whatnot. But they looked at me in my hospital bed and they said, "Aaron, we've never seen what you have before. We don't know how to treat it, but we're going to actively treat it with these medications for similar stuff." So they had me on about 5 different IV medications. Like I said, it froze my arms. I couldn't move my arms. I mean, it was hell. I still remember May of 1999 because of that. I mean, when I was in the hospital for 12 days, when I came home the first day, it felt weird. I felt like I shouldn't be here right now. I should be in the hospital. I mean, near the end, I was getting day passes. They would cap my IV. I'd be able to go out. But I couldn't eat anything. I couldn't drink anything. So it was just, I withered away to nothing. And it's funny, at that point, before I went into the hospital, I was, like I said, I was in shape. Very, very, very good. I worked, at that point for 2 years bodybuilding. And I was in very, very good shape. I went to the hospital, I was about 135 pounds. And when I left the hospital, I was about 111. So I lost close to 20 some pounds from not eating and not drinking. I literally watched my body waste away. I remember I took a picture not long after I got out of the hospital, and it's just like I'm just a mess of skin. Like, I'm not cut, I'm not built, nothing. I don't have shoulders, I don't have a chest, biceps, triceps, and I have abs, and I'm nothing. I'm just there. Like, and that was a major shock too, because I felt like all my hard work to get to that point as a bodybuilder was my goal, was to become like, I trained, I knew my supplements, I knew my training regimen. You know, I was a personal trainer for a few people. Well, not necessarily a personal trainer, but I helped a lot of people out. And to have all that taken away from me because of that sickness crushed my spirit. You know, I was bugged a lot in high school by people that were supposedly friends of mine, and they really contributed a lot to my stress level. Like, they just bugged me about the stupidest things. These so-called friends bugged me because I worked out at the gym. Just call me Arnold Schwarzenegger. Just call me Arnold because I worked out at the gym. Now, the guy who did that the most, he's always in the gym. So he was calling me that back in 1998, 99, making fun of me because I worked out at the gym. Now he works out at the gym. So I guess, you know, back then I said, you know, well, fuck him. I'm the one getting in shape, and I'm the one who's, you know, getting tough, and I could fucking bench press 3 times what you could do, buddy. But anyhow, yeah, like, a lot of things contributed to my being hospitalized that first time, I believe. Stress on a daily basis of being teased by these so-called people that were supposed to be my friends. Like, it was just like, I don't even want to go around that certain area, just let them walk by there, because I'm going to get, you know, names yelled at me and stuff, and just stupid stuff. You know what I mean? But then one day I got mad, and, you know, I had enough. One guy, we got into a fight, and nobody really won, I guess. I almost put him through a display case, but anyways, it's just I had enough. It's just a lot of stuff in high school too, right? Like bullying. I would say I was bullied, but there's a lot of people that did bug me for just stupid things. I mean, one time, one guy threw a volleyball across a gym at me, and the guy was so good that he smashed me right in the face with the volleyball. Smashed me right in the face. My glasses shattered all into my face. Couldn't see nothing. I was just completely. He knocked me out practically. I don't know how the hell he managed to do it. And yeah, nothing was ever really done with this guy. He never replaced my glasses. You know, procedures to get it up. You know, nothing. Anyways, that's just stupid high school stuff. Stupid people. So all these things that contribute, you know, your stress level, makes you wonder if stress really did contribute to what happened to me the first time. I don't know. It's hard to say. I could go on forever talking about this topic. But this is a side of me I don't think I've ever mentioned on YouTube. If anybody's taking the time to watch this, I'm not looking for a pity party. I'm not doing that for this. It's just, I just want to let the people that have subscribed to me for music videos, just to show them a side of me that exists in my life on a daily basis, and that affects me. You know, it's been affecting me for the past 15, 16 years. So thanks for watching this. I appreciate it. If you can relate to any of this, I would appreciate any comments you can give. Tell me your story. I'll watch your videos even if it's 3 hours. Or message me or whatnot. If you had similar situations or whatnot, I'd be glad to hear it, because I can relate. Like I said, I thought I was going to die a few times, so I've seen it, I've done it, I've had it all. So, thanks a lot for watching. I appreciate it very much. Thanks.